today's session of Anthropometry in Adults 18 plus age and Lactating Mothers. I, Dr. Seema Dange, Principal, Dr. G.D. Paul Foundation, YMT HMC, Kharghar, Navi Mumbai, Maharashtra. Welcome all. In session 2 of Anthropometry in Adults 18 plus age and Lactating Mothers. In the first session, we saw how anthropometry affects or how it is used as an indicator for the adult age, for determining few diseases, for determining few parameters like underweight or obesity and plus lactating mothers. In this session 2, we will be focusing on the parameters which are going to be used for the anthropometric measurements like height, weight, body mass index, waist circumference. These all parameters are used for how to determine the anthropometric measurements. So let us see a template for that. Anthropometric measurements, indices and their interpretation in adults. The indices and associated conditions in this age group are as shown below. Nutritional condition that the measurement index identifies. First is height, used on its own to determine short stature or with other measurements to determine other nutrition conditions. Weight, used on its own or with other measurements to determine multiple nutritional conditions. BMI, underweight, thinness or overweight obesity. Waist circumference, overweight obesity or central adiposity. Some of the anthropometric measurements which are used are listed below. Let us see first height. Height is used in assessments of both undernutrition and overweight in adults. Now height as such is a very important parameter, how well the person is nourished for the anthropometric measurements. Height of a child, height of an adult, how the height affects, that is the most important parameter of this measurement. Height in adulthood reflects both a person's genetic potential for growth and the influence of environmental factors that have affected that growth potential. Now, in adult age, this is very important. If a person has grown in a particular height, why the person has grown up to that height, definitely genetics will play a role. It is not just we will push everything on genetics and we will do nothing. Genetics definitely plays a role, but the person's nutrition and the person's fitness. Like when the children are growing, we encourage children, you ride bicycle, you jump, you use skipping rope, you use a bar and you climb the bar so that your bones will grow and your height will grow. So it is an influencing factor. Height is a very important influencing factor in the adult age, and it depends upon the environmental factors also, and it depends upon the genetics also. Many factors can influence a person's height aside from his or her genetic potential, such as poor nutrition in utero and during early childhood and acute and chronic diseases. Height is a common anthropometric measurement taken in adulthood as it is required to determine BMI. It is also used to determine short stature. We have already seen in session 1 that undernutrition is going to result in short stature in the adulthood and stunted growth in children. So height is an important parameter. Why height is important parameter? Because we are going to use this parameter for analyzing the body mass index, BMI, which we will call it as. So height, as we said, it depends upon the genetics as well as the nutritional status of the child. So if the nutritional status of the child is hampered in childhood as well as in utero. So in session 1, we have already seen that a fetus in a malnutrited mother is going to become malnutrited. So a malnutrited mother is going to give birth to a malnutrited child. So it is very important for the society to look into, to take into consideration the diet of a pregnant woman. So if a pregnant mother, if a lactating mother is very well nutrited, then it is going to result in a well nutrited child. So the child is not going to suffer from stunted growth, and as a result, when the child grows up, there will be no problem of short stature. Weight. Weight in adults is an important aspect of a person's health and nutritional status. So as we already said, weight, what is weight? It is an important parameter. What important parameter? About the nutritional status. That means if a person is eating well, if a person is keeping a good nutritional status, the weight of the person is going to be normal. When I talk about this, I mean both. I mean to say malnutrition, undernourishment, as well as overnourishment, which is going to lead to obesity. Weight is a common anthropometric measurement taken among adults as it is required to determine BMI. Significant weight loss over a short period of unintentional can be a signal that an individual has an underlying health issue that must be addressed. For example, cancer, infectious disease, or depression. Weight is taken for determining BMI, which is the body mass index. We'll come to that. But if a person has got lower weight for a consistently long period, then the person has to be identified, the person's underlying disease has to be identified, because it is quite possible that the person must be suffering from any chronic disease, any infectious disease, or also we cannot neglect the mental health. The person may be suffering from mental disease like depression also. So nowadays, depression is a disease which is spoken worldwide. It is spoken by celebrities. It is spoken by celebrities like Deepika Padukone. It is spoken by celebrities like Alia Bhatt, because her elder sister Shaheen Bhatt is suffering from depression. So many celebrities, they talk openly about depression. Is it that depression exists only now and it was not existing initially? No, it's not like that. It was existing initially, but people could not identify that this type of mental state is called as depression. But what happens commonly in depression is that the appetite goes down. So if a person is not healthy physically as well as mentally, the person's appetite is going to grow down, and the person is going to, it is going to result into malnutrition and underweight. So the weight will go down and the patient will go in category of underweight or thinness. Adults typically gain weight until they reach a certain age. Among men, weight gain tends to plateau around age 65 and then decline, while weight gain for women generally continue until around age 75 and then tends to plateau. Now when we talk about this, adults, it is not that a person is growing and growing and growing, and if a person is still 100 years of age, he is going to grow. It's not like that. Growth or the physical pattern of the body, the anthropometry of the body, it continues till a certain age. In males, it continues till the age of 65 and then it plateaus. What is the meaning of plateaus? Beyond that, the person cannot become overweight or cannot increase weight. So it plateaus in males at the age of 65, and in females it is seen that the process still goes on. After 75, the weight of the female plateaus. That means it does not increase after the age of 75 in females and after the age of 65 in males. BMI. BMI is the ratio of weight relative to height that is used to identify underweight or thinness and overweight and obesity in adults. BMI. What is BMI? Body mass index. How to identify this body mass index? This body mass index is identified by two parameters. One is height and one is weight. So depending upon how much is the height of the patient and how much is the weight of the patient, we will calculate the BMI, and we can put the patient that BMI less than so and so is underweight, BMI more than so and so is overweight. So for that, we have a formula for calculation of BMI, which we all doctors should know how to calculate BMI, because as I said, nowadays there is a rising problem of obesity, so one has to calculate BMI and one has to convey to the patient that if your BMI is up to is crossing a certain limit, then the person has to think of weight loss, otherwise the person is going to suffer from different types of diseases. It is calculated using the formula weight in kilograms upon height in meters raised to 2, and its cutoffs are not age or sex specific. How BMI is calculated? Weight of the patient upon weight is taken in kilograms, the weight of the patient upon the height in meters and raised to 2. That's how the BMI is calculated. This is a formula for calculation of BMI, and this is not age or sex specific. Like, it is not that for a particular age BMI is calculated in this way, or in males it is calculated this way, or in females it is calculated this way. It is not that. It is not age specific, it is not sex specific. It is general guideline to calculate the BMI, that is body mass index, which is weight in kilograms upon height in meters raised to 2. Although it is not a direct measurement of body fat and does not distinguish between muscle weight, fat weight, BMI is moderately correlated with more direct measurements of body fat and is strongly correlated with various metabolic and disease outcome. Though BMI is not an exact parameter, though we calculate BMI, but it is not an exact parameter to say that this is harmful or this is not harmful, but definitely it gives us an indication that after calculation of BMI, if it is too much on the higher side, then the person has to be warned that your BMI is so high that you are vulnerable for few fatal diseases. And again, like previously I said, metabolic diseases like diabetes, hypertension, the patient is vulnerable for all these diseases if BMI is going much above the normal limit. Because BMI may overestimate the body fat in a person with a muscular build and may underestimate body fat in older adults who have lost muscle, it is best to use BMI in conjunction with other information such as overall health, age and activity level to provide better insight into an individual's nutritional status. With the help of BMI, we can estimate the body fat. But what happens in old age, there is already loss of muscle. Loss of fat, loss of muscle. So, though it is not, again I said, though it is not an exact parameter, but we can come to a conclusion that BMI can definitely help how to analyze or how to come to a conclusion that the person is suffering from underweight or the person is suffering from overweight or obesity. BMI in general is not the sole parameter to identify this. It's not a sole parameter, but if a person is suffering from some symptoms, like BMI is on a higher side, and if a person is suffering from loss of appetite, or loss of weight, then we can correlate that with diseases like say tuberculosis or cancer. If the BMI is less, I'm talking about, or if the BMI is on the higher side and the person is giving symptoms of increased thirst, increased frequency of urine, then we can put that person in the category of we have to analyze whether the person is suffering from diabetes mellitus because his BMI is already on the higher side. So BMI is not the sole parameter, but along with the other signs and symptoms of the patient, we can identify the patient as obese, suffering from some disease, or underweight, suffering from another disease. BMI cannot be used to assess the nutritional status of women who are pregnant or within 6 months postpartum and does not account for edema. BMI is not to be used for assessing, used in pregnant women, because in pregnancy the weight of mother is physiologically increased. There is a fetus in the womb, so mother is going to eat extra food. She is hungry because she is feeding the baby also. So we cannot take BMI. We said it is a calculation of weight and height. The weight is increasing physiologically in pregnancy, so we cannot calculate BMI in pregnancy because that's a physiological rise in weight. Also, we cannot calculate BMI in edema. Now, what is edema? Collection of lot of fluid in the body is edema. which is a result of diseases. So in edema also, the weight of the body is increased because of accumulation of fluid. So it is not a parameter for identifying the fat or amount of fat in the body, because the weight of the body is increased because of fluid, because the patient is suffering from edema. So we should not use BMI in pregnant women, and we should not calculate BMI in edematous patients. Waist circumference is a measure of abdominal or visceral fat. Increased waist circumference is associated with risk of diabetes and cardiovascular disease. Measuring the BMI, we are talking a lot about obesity, we are talking a lot about being underweight. Parameters used for anthropometric measurements. So as height is a parameter, as weight is a parameter, even waist circumference is a parameter. How? Because obese people have too much of weight around their abdomen. So waist circumference we can take by tape. Weight around the abdomen, waist being having a big waist circumference, it is not only dangerous. The person is not only suffering at a risk of metabolic disorders, but also, as I said, the whole abdomen is pulling the body in front. So vertebral column from behind also gets pulled, and person can also suffer from lumbar disorders. Person can suffer from lumbar disorders also or prolapsed intervertebral disc also. So waist circumference is also an important parameter for anthropometric measurements, because in males the weight around the waist, weight around the abdomen, the fats they deposit around the abdomen, so weight around the waist increases. So that circumference of the waist increases, and that can be taken as a measure for anthropometric measurements. Waist circumference can be used on its own or in combination with BMI to determine increased risk of morbidity and mortality due to excessive abdominal fat. Now again, these are interlinked. Waist circumference and BMI. If a person is showing a big waist circumference and also a increased BMI, then in conjunction, in sync, these two parameters can be taken to assess the morbidity and mortality. What do you mean by morbidity? That is the disease rate. And what do you mean by mortality? That is the death rate. So particular diseases like say heart diseases, stroke, they've got a lot of mortality rate. Or morbidity is chronically the person can remain ill. So waist circumference and BMI together, they can be synced for getting the vulnerability of the patient, whether he is going into a morbid category or whether he is going into fatal diseases like stroke or heart attack or cancer, which is going to increase the mortality rate of the person. Then next is the MUAC, which is the mid upper arm circumference. It is used to identify moderate and severe malnutrition in adults by measuring the circumference of the mid upper arm and comparing it to an established cutoff. This is again an important sign. This is important sign in children also. As I said, mid upper arm circumference from the shoulder joint to the elbow joint. This is the arm anatomically we say, and the upper part of it. So this circumference is measured, which is called as mid upper arm circumference. It is also called as, the short form used is MUAC. This mid upper arm circumference is used as a parameter to identify the nutritional status of the patient. This is more used in childhood. In children, this is a very important parameter for checking the anthropometric measurements and for checking the malnutrition. In adults also, this MUAC is used as a parameter for checking how much the person is undernourished or how much the person is overnourished or going towards obesity. Some useful charts for this category are as follows. BMI classes for adults, classification, underweight. We have in this template we can see two columns. First is the classification and second is BMI, that is kilogram per meters, weight upon height, and the cutoff points. So when we talk about this, for underweight, their parameter is BMI less than 18.50. Then underweight is severe thinness less than 16, moderate thinness 16 to 16.99, mild thinness is 17 to 18.49. Normal range is 18.50 to 24.99. For overweight, BMI more than 25, obese more than 30, obese class 1 30 to 34.99, obese class 2 35 to 39.99, obese class 3 is more than 40. Now this template is important parameter. We have already said in earlier points that BMI is not the sole parameter to understand whether the person is malnutrited or whether the person is obese. But this is going to give us a rough guideline. This template is going to give us a rough guideline. When we say conditions, underweight is also mild, moderate, severe, and overweight is also mild, moderate, severe, or we can divide that as obese 1, obese 2, obese 3. So when we are talking about underweight, less than 18.50, severe thinness less than 16. So these parameters which are given in the template are going to give a guideline to assess whether the patient is undernutrited or whether the patient is overnutrited or obese. Again, obese category 1, obese category 2, obese category 3. And then the end category is above 40. If the BMI is above 40, then the person is highly at a risk of getting severe diseases. So what you should advise, why these parameters are required for us? BMI is 18.50 to 24.99. That is the normal range. It's a range. As I said, it is not a sole parameter. So we will give a range from where to where. This is a rough guideline. If the parameter is exceeding, if the BMI is exceeding 40, that is too much. So then the person needs to reduce weight drastically, because the person is now at a risk of severe disease. Any disease, could be a metabolic disease, could be a orthopedic disease, could be osteoporosis, could be anything, any disease. So the person is at a risk of disease if the BMI is exceeding 40. Now you must also make the patient aware of this. You must also make the patient aware of this, that BMI is calculated according to your height and according to your weight. So for so much of your height is so and so. So for this height, your weight should be so and so, but it is exceeding. You are falling into category of obese 1 or obese 2 or obese 3 depending upon the BMI. You calculate the BMI and put the patient under category 1, 2 or 3 and then make the patient aware that your BMI is now exceeding to a height. It's not that you have to wait till the BMI becomes 40. Even if it is in the basic level, obese 1 level, then also you have to make the patient aware that now your body is going towards the upper end of obesity. So stop here. Stop here, try and modify your lifestyle, try and modify your eating habits and pull down your weight. Bring down your weight, bring down your BMI to a normal level so that you will not suffer from diseases. So how this BMI is going to help us to improve the health of the society? It is going to help in this way, so that we can understand whether the patient is going towards the underweight category or whether the patient is going towards the obese category. Waist circumference in adults. Let us see the template. Agency who has recorded is WHO. The template is divided into two parts. First is the agencies who have done the study, and second is the parameters mentioned for increased risk of disease. WHO says men and women substantially increased risk of disease. The parameters are more than 94 centimeters. In women it is more than 80 centimeters. Men more than 102 centimeters. Women more than 88 centimeters. This is about the waist circumference which are talking. International Diabetes Federation says that Asian men in Asian refers to South Asia, Chinese and Japanese. It's the 19 centimeters, more than 94 centimeters in European men, more than 80 centimeters in European and Asian women. According to US National Cholesterol Education Program, men who have more waist circumference more than 102 centimeters and women who have waist circumference more than 88 centimeters are at the increased risk of disease. Then range of cutoffs established by the countries for men more than 80 centimeters to 96 centimeters, women more than 75 centimeters to 99 centimeters. These all parameters pose the person for increased risk of disease. So as we said about BMI, so is true for waist circumference. Waist circumference up to a certain limit for females as well as for males poses them for increased risk of disease. And again I see that this is a parameter in society. Once there is economical growth, people start eating a lot of food because they have got money. They can Swiggy, they can Zomato, they can order food, they can afford to eat lot of food. There is no exercise because they drive cars. They don't focus on losing weight. So waist circumference, that is the deposition of adipose tissue around the waist, starts increasing. And then WHO, then US Federation, they do a study like how much it is in South Asian peoples, how much it is in Europeans, how much it is in Africans. They do a parameter study. See, this parameter study is also important because again food patterns, they differ. Right? Food patterns differ, height and weight differ. If you see Asian people, they are more shorter, like Indian people have an average height, but if you see Japanese, Chinese, they're shorter people. And as compared to the Africans, they're taller, they're heftier people. So depending upon the race which you belong, Asian ho, European, this Africans, so depending upon the race also, these parameters will change. But overall, waist circumference, if it is going to increase in males as well as in females, it is going to give rise to increased risk of diseases. Again, the list of diseases is n number, but one has to do counseling of the patient that see your BMI is on a higher side and your waist circumference is also on higher side. So you need to take a lot of action on your food habits as well as on your exercise patterns. It's not just food habits, but a person also has to give attention to the exercise pattern also. And now, as yoga is now a very important part, yoga was a very important part of Indian lifestyle. We should be thankful to Ministry of Ayush for promoting yoga, because yoga is a wonderful science. And for all this type of patients who have got increased BMI, who have got increased waist circumference, there are n number of asanas in the yoga which will particularly focus on that abdominal fats or that particular metabolic disease. And if you put yoga as a lifestyle, yoga is not a treatment, yoga is a lifestyle. It's not that I did yoga for 10 days and now I'm fit. It is not like that. Yoga is a lifestyle. Consistently you have to follow it every day. You have to take a training from trained yoga masters. And once you are trained, you can do yoga sessions on your own, but you have to do yoga sessions daily. It is like you eat daily, you take bath daily, you have to pass your urine stool daily. The same way you have to do exercise daily. And that yoga will form a part of the daily exercise. So when we are talking so much about increased BMI and obesity and waist circumference, we must also talk about yoga. We must also talk about the factors which are going to help to control this obesity or this malfunction. And again, I would say that everybody should take help of yoga. Ministry of Ayush, as I said, we should be thankful because they have incorporated yoga in all the years for study purpose. So right from first year, now students are going to know how a asana is and know the basics of yoga. So we must incorporate yoga for bringing down all these parameters and leading healthy life in society. Now the third template is about BMI and disease risk in adults. Now this template is divided into again different parts. There is first column mentions about the obesity. The second column is how much the body mass index should be, and if it is more than, then the person is posed to disease risk. The first category is overweight. BMI between 25 to 29.9 is termed as overweight. Then the parameters are given in men, women, how it is increased and high. In men, if the BMI is more than 102, if the women more than 88, then it is increased overweight. In obesity, the body mass index is 30 to 34.9, that is class 1 obesity. 35 to 39.9, that is class 2 obesity. Again, very high risk of diseases relative to normal weight. Then extreme obesity, if the BMI is more than 40, then it is class 3 obesity, and the risk is extremely high. So again, to keep BMI in normal, these are the parameters which you should know, which are mentioned in the template. And again, I said this is a rough estimate, and to reduce the risk of the diseases in society, this BMI is used as a parameter by doctors, by nutritionists also, by dietitians also. And to reduce the BMI, one has to again take a help of dietitians to reduce the diet or to manage the diet, and also the exercise pattern, or as I said, person should switch off to yoga. Then the last template is about bilateral pitting edema in adults. This template is also divided as how much is the edema, the grades of edema, and the nutritional status. So no bilateral pitting edema, grade of edema is absent, nutritional status does not have edematous malnutrition. Then second says present edema, bilateral pitting edema present in both feet and ankles. Then grade of edema is mild, and the nutritional status is severe malnutrition. Then bilateral pitting edema present in both feet, ankles, plus lower legs, hands or lower arms, then it is moderate grade of edema, which is labeled as severe malnutrition. And the generalized or including both feet, legs, hands, arms and face, then it is severe malnutrition, severe grade, and the status is labeled as severe malnutrition. Now, edema is again pitting edema. Pitting, what is the meaning of pitting edema? When you press, edema is usually observed on shin of tibia in the lower extremity. So the anterior part of the tibia is subcutaneous. So fluid gets accumulated there very easily, and you can see edema on the shin of the tibia, and or on the feet also. And when you press and when you release, there's a pit in the dent in the skin, that is called as pitting edema. And pitting edema can be generalized all over the body. Edema can be seen on the lower part of the eyelids also, because there are a few pockets here, few space here, so that edema gets accumulated. And edema is definitely a dangerous sign of malnutrition, or also of disorders. Kidney disorders usually gives rise to edema or accumulation of fluid in the body. And how edema is used as a parameter? The bilateral pitting edema, again, if it is only on the feet, if it is feet and arms, if it is whole all over the body, accordingly it is divided as mild malnutrition, severe malnutrition, or extremely malnutrited. So there are many people who do study on malnutrition. Dr. Abhay Bang is one of the eminent persons who has done a lot of study in the Meghat jungles on the Adivasis, and he has developed so many parameters to study malnutrition. There are many people like him who study malnutrition in the underprivileged children also, in the underprivileged adults also. And this is also one of the parameter which is saying that pitting edema, how to identify it, how to take it as a parameter to identify whether it is mild nutrition, whether it is moderate malnutrition, or whether it is severe grade malnutrition. So overall, to sum up, what we understand in this anthropometry in the adult and child, that anthropometry, which is the measurement of the body, is the study has an important aspect wherein the height, the weight, the body mass index, and the waist circumference and the mid upper arm circumference, all this collectively decides how a person's body's shape and size is going to be affected, and how this is interrelated, correlated with the amount of nutrition the person is gaining and the amount of diseases the person is having, right, in malnutrition, or the amount of extra food the person is eating and the amount of obesity he is having. So this whole measure in the society is going to help the physician to understand how the nutritional status of the people of the society is going to affect. As in the opening statement we said, it is going to affect economically, it is going to affect the nation building also. Like a person who is fit and fine, who is going to work for 10 to 12 hours, is going to earn bread and butter for his own family, for himself, and in turn he is going to help the society, and in turn it is going to help in the nation building. So I hope you all enjoyed my session of anthropometry. Thank you very much.
Hi students, I hope you liked all 10 videos on fundamentals of anthropometry. And moreover, I hope that you understood the fundamentals of anthropometry, and that was our purpose to select this subject of elective for you all. I am here to give vote of thanks. At the outset, I would like to thank the entire team of National Commission for Homeopathy, New Delhi. Specifically, I would like to mention the name of President of Homeopathy Education Board of NCH, respected Dr. Tarkeshwar Jain sir, and the member of Homeopathy Education Board of National Commission for Homeopathy, New Delhi, respected Dr. Mangesh Jatkar sir, for giving us this opportunity to present our subject of elective on anthropometry. All my colleagues are very happy to thank the entire team of National Commission for Homeopathy, and of course, the entire team of Vizag, Gandhinagar, Gujarat. Please try our elective and perform well in your online assessment. Thank you.